I know you're wondering what's the relationship of diabetes with physical activity. Now, I'm going to explain it to you, but before I do that, I want to welcome you to my channel and I'll walk you through, this relationship as we, go into it. Okay? So I'll be doing a kind of walking around, okay? Although it's drizzling for now, but I'll be doing a kind of walking around just to give you an understanding of what it looks like, right? So you don't go about, making it look so tedious for you, right? So I'm just doing a walking around, and after that, I'll do a treadmill for at least 30 minutes, but you don't have to do it exactly as I am doing it right now, right? So you could just do a walking. Just look at how I'm walking now. Okay, it doesn't need to be something so difficult, right? So it's something that you need to make it a lot easier. You can make it a brisk walking, if you can walk faster, and if you need to walk slow, if it's at your pace, fine, but it doesn't need to be something very difficult. Okay, just do it gradually, and with time you get the result, right? So it doesn't need to be something you go overboard. Just at your pace. You can make it a brisk walking. That's the required standard. But if you're an elderly person, or you discover that your knees are getting feeble, okay, just take it gently, right? Just take it gently, and you don't need to make it difficult for yourself, okay? And then to make it more enjoyable, or for you to enjoy doing it, you can just put on a headset or just play something on your phone, just to be entertained while doing it, so that you don't get bored, right? So that's it. That's just how it goes. So I'm going to be doing this for the next 10 minutes or thereabouts, if the rain will permit. But if not, I'll go do treadmill. I think the rain is getting very serious, right? So we'll go do treadmill right away. So we are on our treadmill and we are good to go. Yeah, so just have to make it. This is like brisk walking, like walking fast, So instead of me going under the rain, I just will have to, use the treadmill. I'm I'm actually on a place, but on a treadmill, so it looks like I'm walking, right? So just to make use of the space. If you don't have a space, which is something you can afford, fine. But if you have a space and you don't have a treadmill, it's also good. Just do some kind of, faster walking, you know. And if you know that, like I said earlier, if you know that your knees are feeble, you're getting older, you're not elderly. Elderly is between from 65 years and above. What you will do is just to make it a walk, right? A normal walk. Yeah, you still get a good result from it, right? So we're going to do at least a 30 minutes, you know, walk on this treadmill. So, so if you need some kind of entertainment, you can put on your media, play something as you enjoy it, do the workout, you know, so that you don't get bored, right? So that's just it for that. Not really easy, I know, yeah. Exercise, physical activity is not easy. Anybody that is telling you that it's easy, the person is not being truthful. But look at it from this angle. If medications, nobody likes to, take medication. No matter how you want to pretend that you love taking medications, if you were not sick, you won't take medications. Nobody likes taking it for fun. So it's just because of the condition that we take medications, because that is what we need to be healthy. So see some of these things as the same way the doctor will prescribe medications to you. See the menu as your medication. See your physical lifestyle, your lifestyle activity as your prescription, right? The same way you're prescribed your medication, these other things are your lifestyle change prescription. So if you can see it from that light, I can assure you, you will be better for it. Okay? So that's it, guys. So don't get discouraged. Don't ever get discouraged. This is something that will help you crush your sugar and remain healthy for your sexual health, especially for the men, right? Yeah, the women also need it. But this crush your sugar challenge, we're focusing on the men because we know that they are the most hit when it comes to sexual, their sexual life. So that's it, guys. So it's not going to be easy, I tell you. This is a whole lot, engaging for your muscles. But the good part is, as your muscles are getting stretched, they are taking up sugar because the energy they need to go through this is in that sugar. And there is nothing else that they can take. This is why when you don't eat, to provide your body with sugar for a period of time, you discover that your muscles are weak. You don't have strength to do anything, not even to exercise or engage in any physical activity. So your sugar can be an asset. Okay? That sugar can be an asset. That excess sugar can be an asset if you can challenge it, to become your tool for physical activity. So the more you engage in it, as long as your heart, you don't have, issues with your heart, because there's a caveat there. If you know that you're hypertensive or you have, any cardiac disease, yes, you need to be careful with the kind of things you do so that you don't cause any chaos. Alright? So if possible, you can see a physiotherapist so that they can prescribe, an ideal physical activity for you to engage in, right? So I'm not a physical activity expert, but I'm just playing my role to help you, to motivate you to get going. Alright? Coming on your legs. Nothing without your grace. 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 Everything by your grace. Everything by your grace. Everything by your grace. You are so gracious, so kind, so full of love. Who am I without you, grace? You are so gracious, so kind, so full of love. Who am I without you, grace? Oh, everything by you, everything by you, everything by you, everything by you, grace. Nothing without you, grace. Nothing without your 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 grace. Everything by your grace. Everything by your grace. Everything by your grace. Everything by grace. You are so gracious, so kind, so full of love. Who am I without you? You are so gracious, so kind, so full of love. Who am I without you? Your grace overwhelms me. Your love overwhelms me. Who am I to grace? Darling, your grace overwhelms me. Your love overwhelms me. Who am I without your grace? Still I walk out. We're digging it. We're digging it. We're digging it. Your grace overwhelms me. Your love overwhelms me. Who am I without your grace? Your grace overwhelms me. Your love overwhelms me. Who am I without your grace? Your grace overwhelms me. Your love overwhelms me. Oh, who am I without your grace? Your grace overwhelms me. Your love overwhelms me. Who am I without you? Your grace overwhelms me. Your love overwhelms me. Who am I without your grace? Grace overwhelms me. Your love overwhelms me. Who am I without your grace? The grace overruns me. Your love overruns me. Who am I without your grace? Darling Jesus, your grace overruns me. Your love overruns me. Oh, who am I without your grace? Your grace overruns me. Your love overruns me. Who am I without your grace? Not easy, not easy. It's not easy. It's not easy. It's not easy. It's only for a living the God is seen it. All things new. Oh, all things. I know it's done. I know it's done. Woo! Grace overruns me. Love overruns me. Who am I without you? Grace overruns me. Love overruns me. Hey, hey. Who am I without you? Grace overruns me. Love overruns me. Who am I without you? Your grace overruns me. Love overruns me. Who am I without you? Grace overruns me. Love overruns me. Who am I without you? Grace. Grace overruns me. Love overruns me. Who am I without you? Woo! Everything about grace. Everything about grace. Everything about grace. Everything about grace. going to skip for a few minutes. All right. All right. Whew. So that's it. Then you just put up a dance, um, put some music and dance to it, right? I need to have another gadget, to which I can put some music. So, but it doesn't have to be, um, you know, music per se. You can just dance, sing and dance to yourself, you know, dance and dance, dance inside the house. You can do this for as long as your body allows you to, okay? But like I said, you can mix all of this up, 10 minutes of each of them, 5 minutes of each of them, and, take a walk, for 5 to 10 minutes, you know, do a brisk walk, do a skipping for 5 to 10 minutes, and then do a dance. So that's it. That's it. I don't need to overstress on it. It's something you can actually replicate, on your own. And I know you're able to do it. And I can tell you can actually crush your sugar doing some of these little things, making them a consistent, you know, way of life. Over a time, over a period, you'll see results. Okay. So that's it from me, and I'll see you next time. All right. Bye for now.